Good morning, dear students. So, as we have already started with upper limb and we finished osteology and pectoral region, let us proceed with the muscles of back. Now, when you start doing dissection, when you come to dissection hall and when you just start doing dissection on the cadaver, we should know certain surface landmarks which comes under surface anatomy. Okay. So, what are the surface landmarks we are seeing? Now, see here, the posterior aspect of the skull bone, this area is actually called as the point is external occipital protuberance. Along with that, we have the nuchal lines. Nuche is neck. So we have superior nuchal line. Okay. Then as you proceed, this yellow line is all showing the lines of incision along which we have to give the cut on the skin so as to reflect the skin flaps. So you start with external occipital protuberance, okay? Then the other bony landmarks what we see here are, you can feel the spine of the scapula, you can okay, you can also see and feel the acromion process, the coracoid process, and you can actually feel the humerus bone. In the middle of the humerus, we can also feel for deltoid tuberosity. Now, as you go down, we will see this is the position where we have the last rib, which is called as the floating rib, where one more line is shown. Okay, as you come down, we have sacrum, okay, and coccyx. So this is like certain surface landmarks what we should know. So the hip bone will show its clear cut like bony prominence, which is actually called as iliac crest. Scapula's outline also can be felt over here. Okay. So these are the few surface landmarks which we should be aware when we are giving skin incisions on the back region. Now, once you reflect the skin, the underlying muscles what we see below the skin are, in the first layer, you will see this muscle which is in the shape of trapezium. Only one side is shown. Okay, I will also show the complete picture. So the trapezium shaped muscle we have is trapezius. As we see down, we have latissimus dorsi. The other side of the picture, the trapezius has been cut in order to show the underlying muscles. So below the cover of trapezius, we will see levator scapulae, rhomboid minor and rhomboid major. Okay. Now, the other muscles I will show you with label diagrams. Now, see, this is the cadaver where the skin has been reflected. So we have given an incision right from the external occipital protuberance almost extending up to the sacrum coccyx. Okay, and the skin has been reflected. So once the skin has been reflected, you can see there is one trapezium shaped muscle which is shown only on one side. Again, in order to show the underlying muscles below the trapezium, the half of the trapezium is cut. So this is trapezius where you can see this is upper fibers we have, middle fibers we have, lower fibers we have. This is trapezius or trapezium muscle. Trapezius muscle, once you cut, the underlying muscles what we see are, you are finding, see this is the rhomboid minor muscle, below which you are finding rhomboid major, above which we will also find one more muscle which is not labeled here, that is levator scapulae. In order we have, maybe you should have studied when you were doing scapula bone along the medial border of the scapula, we have three muscles, right? So we have levator scapulae, rhomboideus minor and the major muscles. Now, once you see still deeper muscles we have like longissimus thoracis. Here, once you cut this rhomboideus major and minor, you will see inner side we have a muscle which is called as serratus posterior superior. Correspondingly lower down we use the word serratus posterior inferior. Okay. And of course, this quite big bulky muscle what you see lower down is latissimus dorsi. And attached to the spine of the scapula, above the spine, we know we have supraspinatus and below the spine we have infraspinatus. And this round contour muscle what we have here is deltoid muscle. Okay, this is spine of the scapula completely. This is supraspinatus, this is infraspinatus muscle. Of course, these are not labeled here. Now, let us see what are the various muscles we have in the back. We have extrinsic muscles and intrinsic muscles. So, extrinsic muscles are the superficial muscles of the back where we have trapezius, latissimus dorsi, levator scapulae, rhomboids major and minor. All these we have seen just now, both in the true picture and also in the dissected area. They are all connecting the upper limb to the trunk. Okay, so this is the first muscle, only half is shown, that is trapezius. Once you cut the trapezius, we will see levator scapulae, rhomboids minor and rhomboids major. Okay, so all muscles are shown, trapezius, deltoid. Once you cut the trapezius, again levator scapulae, rhomboids minor and major, above the spine of the scapula, supraspinatus, below the spine of the scapula, infraspinatus. If you remember, along the lateral border of the scapula bone, we have teres minor muscle and then we have teres major muscle, isn't it? Then, so this is the serratus posterior inferior muscle, and the straight muscle which is seen much in deeper compartment on either side of the vertebral column, you call it as erector spinae. This is the serratus posterior superior muscle. Okay, like below this you will find correspondingly, below the rhomboids major and minor, correspondingly we will find serratus posterior superior. Okay, so these are the various muscles we have. So this actually table has been taken from one of your textbooks like BDC and Vishram Singh, any book of your choice, of course. So we have muscles trapezius. Better you learn these tables where you have everything like origin of the muscle is given. Origin is the place where the muscle takes its point of starting point. Insertion is where the muscle ends, and we have to know the nerve supply and action of all these muscles. Okay, extrinsic muscles: trapezius, latissimus dorsi, levator scapulae, rhomboids major and minor. Now, once you know this, now let us see, the nerve supply also is important, action is also equally important, and again this has been elaborated, the same muscles. So let me tell you in detail about each muscle. The first muscle is trapezius. And here you can see it is completely trapezium shaped. Once you have reflected the skin, the very first muscle what you visualize in the cadaver, in the dead body, is this trapezium shaped muscle, that is trapezius. Now let us see the origin of this trapezius muscle. So as you can see, it is large, flat, triangular muscle which is forming the sloping ridge on the neck. So origin is, see, I told you this is external occipital protuberance and this is superior nuchal line. So medial two-thirds of the superior nuchal line, external occipital protuberance. This red line is actually ligamentum nuchae. This is the spine of the seventh cervical vertebra and the spines of all thoracic vertebra, that is T1 to T12. They all give origin. From here till here is the origin point of trapezius. Now these fibers are now divided into three compartments, like we have upper fibers which sweep downwards, they go to the posterior border and upper surface of the clavicle bone, lateral one third of the clavicle. This was told when clavicle bone was described. Then middle fibers, they run horizontally, okay, medial border of the acromion and upper lip of the spine of the scapula. You can see here this blue line. Okay, these are the middle fibers. Now lower fibers, they are ascending upwards and they are going up to the tubercle of the spine of the scapula, which is very close to the root. Now coming to the nerve supply, it is supplied by spinal accessory nerve. Spinal accessory is the, which cranial nerve is this? 11th cranial nerve. Okay, apart from that we have ventral rami of C3 and C4. Action is uppermost fibers along with levator scapulae, they elevate the shoulder, they help in shrugging of shoulder. Okay, then middle plus lower thirds like plus rhomboids, like they help in retraction and steadying of the scapula. Now see this again, I have put this picture to emphasize the trapezius muscle. Okay, now this is the cranial nerve. I told you this is the 11th cranial nerve, that is accessory nerve which is coming out, okay, through one of the foramina of the skull bone, which we will discuss later. It is going on the deeper aspect of the trapezius, supplying the trapezius. Not only trapezius, but also one more muscle of the head and neck region, that is sternocleidomastoid. Now you can see the orientation of the body. This is the head of the cadaver. These are the ears. This is the vertebral column where you have given the cut. The muscle has been reflected. This is the trapezius muscle, and underlying on the under surface of the trapezius, which cranial nerve is going? The accessory nerve. You can see the accessory nerve piercing the muscle and supplying the muscle, which is the motor supply. Okay, motor supply comes from the spinal accessory, whereas sensory comes from the cervical plexus C3 and C4. So that was all about trapezius. So this was our trapezius. Now we are going to the next muscle, that is latissimus dorsi. Quite big muscle it is. So you can see this so much big and bulky muscle we have. So latissimus dorsi, it is widest muscle what you see in the back. So this is wide, flat, triangular muscle on the back region. It is arising from the spines of the lower six, from here T7 to T12. Okay, anterior to the trapezius by tendinous fibers. Then posterior lamina of this fascia, this green in color it has been shown, that is what is thoracolumbar fascia. Okay, then this is the hip bone. From the outer lip of the posterior part of the iliac crest. Iliac crest is the part of hip bone by muscular slips. Okay, lower 3 or 4 ribs also are involved. You can see here the picture has been shown. Lower 3 to 4 ribs by fleshy slips, and this is the inferior angle of scapula. So many points of origin it has. If you remember, I told you lady between two majors when we were discussing the bicipital groove of the humerus bone, isn't it? So in the floor of the bicipital groove, also called as intertubercular sulcus, you will see the insertion of latissimus dorsi. Okay, so this is our latissimus dorsi. You can see how the muscle fibers are moving towards the humerus bone to take its insertion. Floor of the intertubercular sulcus bicipital groove. Okay, so latissimus dorsi, teres major together form posterior axillary fold. This point will come again when we are doing the next lecture, axilla. Now coming to the nerve supply of latissimus dorsi, it is supplied by thoracodorsal nerve. In the next class, you will be learning about brachial plexus. So you will know in detail about all these nerves. For now, if you just know the name also, don't panic. It's fine to know the name. Just this is one of the branches coming from the posterior cord of the brachial plexus, thoracodorsal nerve, which supplies latissimus dorsi. The action of latissimus dorsi is adduction, extension, and medial rotation of humerus. Okay, it's a climbing muscle which pulls the trunk upwards and forwards. It also assists backward swinging of arm during walking. It takes part in all violent expiratory efforts. Next. So now let us move to the next muscle. So in this picture you can see trapezius is no more seen. So once the trapezius is no more seen, we are going and we are now able to see some deeper muscles like levator scapulae. Okay, so the levator scapulae, if you observe, it is coming from the transverse processes of C1. This is the first cervical vertebra, atlas, then we have axis, then C3, C4, so on. So from the transverse processes of C1 to C4, you can see, and the muscle fibers. And this is our scapula bone. We know this is the root of the spine, and this is the superior angle. From the superior angle to the root of the spine, it takes its attachment. That is the levator scapulae. Origin is C1 to C4 vertebrae. Insertion is medial border of the scapula between the superior angle and the root of the spine. Nerve supply comes from the cervical plexus, dorsal scapular nerve. Okay, sorry, this is dorsal scapular nerve is one of the branches coming from the brachial plexus. C3, C4 are from the cervical plexus. These are the spinal nerves which are giving position sense, that is proprioceptive. Now, levator scapulae, it helps in the elevation and medial rotation of scapula and also tilts the glenoid cavity inferiorly. Once you know the levator scapulae, now we will try to see the other two muscles which are taking attachment from the vertebral column to the medial border of the scapula. The upper one is rhomboids minor and the lower one is rhomboids major. So I have used two different shaded pictures to make you understand very clearly. This is rhomboids minor and this is rhomboids major. So you can see the rhomboids minor, it's taking its origin from the ligamentum nuchae, what we have seen for trapezius also, isn't it? Then spines of C7 and T1. This is C7 and this is T1. Okay, and this is the root of the spine where it is taking its insertion. You can see here, root of the spine of the scapula. Okay, so base of the triangular area at the root of the spine of the scapula, rhomboideus minor takes its insertion. Again, nerve supply, dorsal scapular nerve coming from brachial plexus, at retraction and elevation of scapula is the action. Then rhomboideus major, see, this is the major muscle, T2 to T5 spines. It's T2 to T5 spines, and it goes along the medial border coming from the like root of the spine, from the lower border of it to the inferior angle almost. If you understand the pictures, you will write automatically. You need not mug up anything. Try to understand and reproduce. You need to revise and repeat many times to remember the things. Otherwise, at this moment, you may find everything interesting and understanding. Again, if you don't revise, of course, we will all forget. So, spines of T2 to T5 vertebra is giving origin to rhomboideus major, medial border of the scapula from the root of the spine to the inferior angle. So, if you observe all these three muscles, very simple, you just remember dorsal scapular nerve, all these three. Okay, so these two muscles, same thing, like retraction of the scapula. This major is also, rhomboideus major is also helping in the medial rotation and elevation of scapula. Only medial rotation action is added to the rhomboideus minor muscle, isn't it? So like that we have seen the first, completely we have seen how many muscles now. First of all we saw the trapezius, then we have seen the latissimus dorsi, then we have seen the levator scapulae, rhomboideus minor and major muscles. Now once you are done with this superficial layer, now let us go to the intermediate extrinsic back muscles. We have serratus posterior superior and inferior. These are superficial respiratory muscles and they are all supplied by intercostal nerves. Intercostal nerves are the thoracic nerves. Most of them are the typical thoracic nerves, T3 to T6 especially. Okay, then see, this is your serratus posterior superior. Once you have removed the levator scapulae, rhomboids minor and major, once you have cut, you will be able to see these muscles. That means all these are layers. If you remove one layer, you will be seeing the second layer. See, trapezius has been reflected, rhomboids major minor have been reflected, isn't it? After reflecting that, you are able to see the serratus posterior superior. In the same plane lower down, many times in the previous pictures, we have seen serratus posterior inferior as well. So you can see both the muscles simultaneously in this picture. You have serratus posterior superior and inferior. Okay, these are the intermediate extrinsic back muscles. Okay, then these are intrinsic muscles. These are called muscles of the back proper, deep muscles of the back. They are all supplied by posterior primary rami of the spinal nerves. They act to maintain posture and control movement of the vertebral column. So superficial intrinsic back muscles, if we go further, deeper, you can see these muscles. These are the splenius, cervicis and capitis. Okay, this one is cervicis and the higher one, like the above one, the broader one is capitis. Okay, these are the superficial intrinsic muscles of the back. Both muscles. One side we are clearly seeing the splenius cervicis muscle. The other side we are finding the splenius capitis muscle. Okay, these are intrinsic. That means they are found in a deeper plane. Once you remove the trapezius and all, trapezius, rhomboids major, minor, levator scapulae. After you remove those muscles in the deeper plane, we get these muscles. That's why you call it as intrinsic muscles. Okay. Now let us see the splenius capitis muscle, from where it is taking its origin and insertion. Origin is coming from this seventh cervical spine and also T1, T2, T3, T4 spines and also a portion of ligamentum nuchae. This is the green layer. This partition, this is the ligamentum nuchae insertion, you can see the direction of fibers upwards away from midline. That's why laterally in the skull bone you will come across a point which is called as mastoid process, which you can feel for yourself behind your pinna external ear. There it is going and getting inserted. Okay, the lateral one third of the superior nuchal line. Nerve supply of this muscle is posterior rami of middle cervical nerves. Action, it rotates the head and turns the head to the same side. Acting bilaterally, they draw head backwards and extend the neck. Next muscle we have is splenius cervicis. Then it is coming, see, cervicis is this one. This was capitis and this is cervicis. So this is origin from T3 to T6 thoracic vertebrae. An insertion passes deep to the capitis to be inserted into the transverse processes of upper four cervical vertebrae. Okay, here you can see upper four cervical vertebrae comes like this and then getting inserted like this. Okay, upper four cervical vertebrae. Then nerve supply posterior rami of lower cervical nerves. Action, turns the head and face towards the same side. Acting bilaterally, they extend the head and neck. Now, muscles of the back are organized in certain layers. Now, extrinsic we have seen first layer trapezius latissimus dorsi. Second layer we have seen levator scapulae, rhomboids major minor. Third layer we have seen serratus posterior, superior and inferior. Isn't it? They are all extrinsic muscles which are actually attached to the back and the upper limb. They help in the movement of upper limb and also they help in respiration. Now, once you cut this, you will be now intrinsic muscles which act on vertebral column and neck. First layer, just now we have seen the splenius capitis and cervicis. Now, after that, now let us see the second layer. We have erector spinae. Erector spinae, we have from medial to lateral or lateral to medial. We have iliocostalis, longissimus and spinalis. Third layer, in the deeper compartment, we have transversospinal muscle. Together you call it as transversospinal. Subdivisions are, you have multifidus, rotators, and semispinalis. Now, because we have already finished splenius capitis and cervicis as first layer, now let us go to the second layer, that is the erector spinae. It is the chief extensor muscle of the vertebral column and it is divided into three columns. Okay, I told you from lateral to medial. We have lateral most one is iliocostalis, middle one is longissimus, and medial one is spinalis. Okay, like this we have iliocostalis, longissimus in the middle, and most medial one is spinalis. Okay, iliocostalis, longissimus and spinalis, all together we call it as erector spinae. Okay, three, from lateral to medial, iliocostalis, longissimus and spinalis. Okay, you can see the three components of erector spinae here. See, the most medial one is spinalis, middle one is longissimus and lateral one is iliocostalis. Okay, that is. Now, once you know this erector spinae muscle. So nerve supply of this muscle comes from posterior rami of spinal nerves. Action, both erector spinae acting together, that is bilaterally, they extend head and neck from the position of flexion. Acting unilaterally, laterally flex the vertebral column. Okay, the same erector spinae with medial to lateral. You have spinalis, longissimus and iliocostalis. Okay, this is Netter's atlas picture. Here also you are shown like erector spinae muscle with its three components. Medial most is spinalis, intermediate one is longissimus, lateral one is iliocostalis. Okay. These are the other like superficial in the intrinsic compartment. You have semispinalis capitis and cervicis, right? This is the intermediate. Okay. Then deep intrinsic back muscles, erector spinae again divided into two subgroups, major deep layer, minor deep layer. Major deep layer, we have transversospinal group consisting of semispinalis, multifidus and rotators. Okay, they are supplied by posterior rami of spinal nerves. Action is extension and stabilization of vertebral column. Okay. So these blue lines, what are they indicating? Iliocostalis, spinalis, and longissimus. In the sense, these are the parts of which muscle? Erector spinae. Apart from that, if you observe, you are also finding the other muscles which are in deeper compartment, iliocostalis or lumborum. And wherever you have only sheet of aponeurosis, where muscle fibers are missing, you use the word aponeurosis. Okay, sheet, layer, where you do not have any muscle fiber, that area is actually called as aponeurosis. Okay, so deep intrinsic back muscles, you have removed everything. Now you are going into deeper compartment. These are the semispinalis, capitis, cervicis. Okay, now in the same plane, if you go much deeper inside, you are finding multifidus. Okay, and laterally, if you observe, these have been labeled as rotators. Okay, rotators. So these are the small in size, you call it as brevis, rotator brevis. Long in size, you call it as rotator longus. Okay. The minor deep layer, that means you have to dig on, dig on, dig on the back, you will find so many muscles. So minor deep layer, we have interspinals, intertransverse area muscles, levator, costarum. They are all supplied universally by the posterior rami of spinal nerves. So these muscles help in extension, rotation, lateral flexion and stabilization of vertebral column. Okay, so all these like various movements are shown here. This movement is flexion. When you bend forwards, backwards is extension. You can see the sideward movements as lateral flexion and the rotation. Okay. So this picture I have already kept just as a summary of what we have studied. Extrinsic muscles, we have seen first layer trapezius, latissimus dorsi, second layer levator scapulae, rhomboids major and minor, third layer serratus posterior superior and inferior. Next, we had intrinsic muscle acting on vertebral column and neck. First layer we had splenius capitis and cervicis. Second layer erector spinae, iliocostalis, longissimus and spinalis, lateral to medial. Then third layer transverso-spinal, multifidus, rotators and semispinalis. That's it. Hope you have understood. So before I stop, I actually want to just revise very fast the various muscles. Only as you see in the dissection, for your easy understanding. First thing I told you, we have to give a skin reflection. Once you like reflect the skin flaps, first muscle you come across is trapezius, then latissimus dorsi. Once you reflect trapezius, we will see levator scapulae, rhomboids minor and major. Once you cut this rhomboids also, you will see the serratus posterior superior underneath this, below which you have in the same plane serratus posterior inferior, isn't it? We have seen the origin insertion of these muscles, and as we have gone deeper inside, we have seen the erector spinae with its three components, isn't it? This trapezius is the trapezium shaped muscle supplied by the spinal accessory nerve, what we have seen. This is how latissimus dorsi looks, isn't it? So these muscles are, what is this? Levator scapulae, rhomboids minor and major. Different colors have been used. Rhomboids minor is this, major is this. Okay. Deeper inside, I told you we have serratus posterior superior and inferior. This is the posterior superior and serratus posterior inferior. Okay. Then much deeper plane you have splenius, cervicis is this one, capitis is this one. Capitis and cervicis. We have seen origin insertion, right? Okay. So these are the components of erector spinae. Iliocostalis, longissimus, and spinalis, three parts. Isn't it? Spinalis is most medial, longissimus in middle, and iliocostalis is lateral. So these are the various muscles. Try to read, pause the video wherever you are finding the difficulty, then you will understand everything. And always you can get back to me if you have any doubts in Telegram. Thank you so much.